As you move forward through the next few slides, it'll take you through explaining some of the parts, the projections, all the nice stuff, the processes and so forth for our thoracic, the lumbar, the sacral, and the coxal region. Now the rib cage. When we talk about the rib cage, I would not dare ask you something such as, are you looking at rib 1 and 2? Yeah, I'll do that, okay? But anything like 3 to 10, I wouldn't dare do anything like that, okay? Mainly because they're going to look so familiar, all right? Now, when you look at the rib cage, we're going to say, yes, we have 12 pair, okay? 24 ribs. We have what's termed false, true, floating, okay? Note, right up here, rib 1, okay, has a very distinct look. It looks like the letter C, okay? So yeah, I would ask you about rib 1. You should be able to tell the difference. 2, a little bit, okay? But the remaining ones, no. But now what do I mean between true ribs, false ribs, floating ribs?
False ribs don't attach to
The sternum, yes. True do. Do you have any idea what this cartilage is termed? It's termed costal cartilage, all right? But when you begin to look, 1, 2, 3, 4, 5, 6, okay? 6 of them have a direct connection to our sternum. Manubrium, xiphoid process, okay? They have a direct connection from the bone to the cartilage to the bone. When you begin to look down, these ribs that are considered the false ribs, they come in, meet a cartilage that meets the cartilage that meets the bone. So they don't have a direct connection. Their connection is to cartilage. And then when we begin to look at the floating ribs, their attachment is only to the vertebra. All right, so that's the difference between true, false, floating. Floating, because they're not attached to anything but the vertebral column. Does that make sense? So, for the next few slides, it's going to talk to you about what I just mentioned, the manubrium, the body, the xiphoid process, and then gives you, oh, it doesn't go through because I think I took it out because I wouldn't dare ask you about each one of those ribs separately, except for the first one, you know, the first rib. So now, the appendicular skeleton, basically looking at what we know, arms and legs. All right, now something, however, that's present. We have what's termed the girdles, okay? So, for upper arms, we have what's termed the pectoral or the shoulder girdle, okay? The upper limbs include arm, forearm, wrist, hands. Note that I pointed that out. Somebody points and goes, oh, my arm. They're wrong. It's their forearm. So now somebody holds their arm right there and says, oh, my arm hurts. Correct them and go, it's your forearm. Here's your arm. Okay? The wrist, the hands. The lower limbs. Lower limbs, we've got our pelvic girdle, okay? With the lower limbs, what we think of as our thigh, all right? Leg, foot. So now if they go, oh, my leg hurts. Oh, my leg hurts. Correct them. Tell them, nope, hold in your thigh. Okay? Just a little fun, you know, to have with people. Just saying, got to find our happiness in any way we can, right? Now, one of the things that I want you to be familiar with, some of the parts of our scapula, okay? So I want you to be familiar with like the acromion process, the coracoid, the glenoid. And then of course you got to know your clavicles. But because when we look at this, it's one of the most injured areas of the body, okay? It's a very injured area. It's going to walk you through some of those terms that apply to the humerus, some of those terms that apply to the radius and the ulna. And the way that I keep those separate, the ulna goes to the pinky, U to P spells up. Okay, that's just how I do it. Goes through some of those terms as they apply to the ulna, areas that you could palpate in a patient. The wrist and the hands, I'm not asking you to learn all of those bones in the wrist. Okay, I'm only asking for a couple of them. All right, so just make note from the list. Walks you through identifying those bones of the wrist and the hand. When we look at the pelvic girdle, do want you to understand that what we think of as the hip bone, that it's made up of 3 bones. Okay, so when we begin to look at ilium, ischium, pubis, I want you to be able to identify those 3 bones. Takes you through some more of the terms that apply to the pelvic girdle. The parts of the leg that we think about. The coxal bones, because one of the things that'll happen as we look at the pelvic area, we're going to see that part of it is considered a true pelvis, part of it is considered a false. I don't spend a lot of time on that, okay? But that is something that, you know, we say about the pelvic area. The coxal bones, the 3, ilium, ischium, pubis, different markings and so forth that are there. The differences between a male and a female pelvis. Basically, the outlet, the shape of the bones are different. Men tend to have longer, less of an outlet. Women tend to have shorter, more of an outlet, okay, because we got to give birth. Some of the differences between the male and the female. I won't ask a whole lot about that, but just giving you the differences. Terms that apply to the bones that are making up the thigh, which is our femur, okay? Definitely get familiar with the trochanter, okay? Showing you the pictures. Definite difference between a femur and a humerus, okay? Definite differences. Oh, and our patella. Gotta love the patella. It's known as a sesamoid because it's a bone that develops in a tendon. So it's a really cool bone. The bones of the leg, tibia, the fibula, terms that are going to apply. You don't have to know all of them. I would just make a note of the ones that you need to be familiar with. Then our feet. Once again, not asking you to tell me all of the tarsal bones. There's only, I ask you to know the talus and the calcaneus. So those are the 2 that I want you to identify there. This down here is kind of giving you the side view. This is letting you know the different arches that we have in our feet, because it's the arches of our feet that are the reason we walk upright. Technically, we should not be walking upright. We should still be walking bent over. But due to things that have happened with the arches of our feet, the ligaments that are present, we have the longitudinal, meaning an arch that runs the length of the foot, transverse, the width of the foot, okay? That are the reason that we're walking upright. That's it. Yep.